cat that seems to be overly reactive to your touch, or maybe he or she attacks himself and runs away, like trying to escape some sort of pain. Could well be you've got a cat with feline hyperaesthesia syndrome. I'm Dr. Cath Watson and welcome to the PD Pet Care Vlogs. Feline hyperaesthesia syndrome is a really specific problem in cats where they have this massively increased sensitivity to touch or any sort of stimulation of the skin. They can act like they're in pain just from you patting them in a particular area, often along the back. Sometimes they'll be sitting there and you'll just see their hair twitching and they appear to be uncomfortable. In some cases they'll actually attack themselves, particularly somewhere like the tail, or maybe they'll just be screaming around the room crying out like they're in pain. In the more milder forms, they might actually just be licking obsessively or biting at a particular area of the skin. In the worst case scenarios, sometimes touch or certain triggers will actually result in them having a full-blown seizure. Now, we don't fully understand what triggers this feline hyperaesthesia syndrome, but there are a couple of theories. One possibility is that actually this is just an inappropriate pain perception that's followed on from an injury that may well be long healed. It may not have been that major, but when it's a specific area on the body that has been injured previously, there may now be altered sensation at that site. For an example, in humans, there's some amputees describe having this phantom limb pain. So maybe they're missing a leg, so the leg is no longer there, but they can still feel pain in that leg despite the fact it's missing. So similar sort of thing for a cat that's perhaps had an injury, may well be missing a limb, and there's this phantom pain and they don't know what to do about it. So don't like being touched, seems to be painful, need to attack something to get rid of the pain. The other theory is that this may actually be a compulsive disorder, so a behavioural problem. And the theory is that the cat is not being allowed, for whatever reason, to express the behaviour that it wants to. So instead they express a behaviour to kind of replace that one. And then over time that becomes an obsessive need to do that behaviour, and that behaviour often is mutilating or attacking themselves in some form or another. Typically this problem would be most commonly seen in young oriental breeds, so the likes of your Siamese, Abyssinian, Persians to a degree, but it can actually be any breed, any age. As far as our ability to treat it, the goal obviously is to make the cats as comfortable as possible. If there's genuine pain there, it's about removing the pain. If this is a behavioural disorder, then managing that as best we can. So the aim is for a comfortable life. They won't necessarily ever be completely normal, but obviously we want them to have as good a life as they can. So first up's avoiding the triggers. If there is a specific location that seems to trigger pain for your cat or an overreaction, then obviously not touching that spot is the sensible thing to do. And in some cases, that may be all you need to train yourself to do to avoid putting your cat into distress. Second thing is, allergies can actually make this problem worse. They may have triggered it in the first place. So actually looking for potential underlying allergies and managing those. And obviously if you can dial back that sensitivity to the allergies, you may well dial back the underlying hyperaesthesia syndrome as well. There may be medications required. Obviously if you've got a cat who's seizuring as a result of this, then being on anti-seizure medication would be a very smart idea. Managing neuropathic pain with medications like gabapentin, or even using psychoactive medications. So this is the likes of your antidepressants and so on for behavioural disorders, but I would also consider consulting a behavioural expert if that's the case, to make sure that it's not just medication, but we're doing everything else that we can to help those medications work well and obviously give the cats a good life. And then obviously if there is genuine pain there, then looking at pain management. So just to be clear, feline hyperesthesia syndrome is not actually a really common problem. But if you've got a cat that is or appears to be damaging itself or reacting in an excessive way to touch, or seems to be in a huge amount of pain, and there's no obvious cause for it, then please go and seek help from your local veterinarian.